Okay, for our next presentation, I had the opportunity to catch up with Dr. Marnie Graco from Austin Health and was able to record a conversation where she shares some of her work about sleep apnea and the impact that that has on people living with spinal cord injury. So I hope you enjoy.
Hi everyone, thank you for the opportunity to talk to you today. My name is Dr Marnie Graco and I am talking to you today about the research that I do, which is around improving the management of obstructive sleep apnea for people living with spinal cord injury. And I'd just like to say I'm very sorry that I can't be there for the live event, but I do look forward to watching it online afterwards. So just to start with, I wanted to give a brief explanation about what obstructive sleep apnea is. And what it is, as you can see here, when a person normally would sleep, their airway would stay open throughout the night, allowing that air to come in through the mouth and nose and down into the lungs with no problems. But when someone with sleep apnea falls asleep, we all have a bit of a relaxation in our muscles in our upper airway. And a person with sleep apnea would commonly experience their airway to collapse or to snap shut during the night. And this would stop their breathing for about a period of 10 seconds or longer. And during this time, their oxygen saturations in their blood will drop and a message gets sent to the brain to tell the brain to wake up so that they can start breathing again. And so they will have these little mini wake ups. Often they're not even aware of them. And the problem is that this happens over and over again throughout the night. And it causes a very disrupted and unrefreshing night's sleep. Sleep apnea is usually diagnosed when someone will talk to their doctor about their signs and symptoms, and that doctor will then refer them for an overnight full sleep study in a hospital or a sleep laboratory to diagnose it. And you can see here this person with the full setup of the sleep study in the hospital. It is becoming a bit more common now that there are other ways to diagnose sleep apnea that are a bit less complicated and can be done in the person's home. And this gentleman over here is modelling that for us. So I'm going to talk a bit more about that later. So once the person's diagnosed with sleep apnea, it's usually treated with continuous positive airway pressure, or CPAP. And what CPAP is a machine that blows a steady stream of air through the tube, down through the person's nose and or mouth. And what it does, that air, is it splints the airway open. So you can see here that the airway's collapsed. But in here, with the steady stream of air going down, it keeps that airway open and it stops that breathing cessation throughout the night. And so for those who can use CPAP, it's actually a really effective treatment. There are a couple of other treatments available, the most common probably being this mandibular advancement splint, which is this mouthguard-like device that pulls the lower jaw forward when you sleep and helps to keep that airway open. For some people, sleeping in different positions can be effective and weight loss can be effective. And for those who have an anatomical cause of their sleep apnea, surgery may be effective for some. So the background of the research I do is that sleep apnea, we know, is caused by having a quadriplegic spinal cord injury. Some of you may have heard of or know of Professor David Berlowitz, who works at the Austin Hospital and Melbourne University. And he was the first one to discover that people who had a cervical spinal cord injury, most of them would have developed sleep apnea within 3 months of their injury. In the last couple of years, we've gathered together all of the research that's been done around the world about how common sleep apnea is in people with tetraplegia. And what we estimated is that 83% of people with tetraplegia or quadriplegia have obstructive sleep apnea. And over a third of them have what we would say define as a severe level of obstructive sleep apnea. So it is a real problem. We've also done research that's shown that it's linked to daytime sleepiness. It's linked with problems with sort of concentration and memory, and also reduced quality of life in people with spinal cord injury. The recommended treatment practices involves the routine screening for signs and symptoms of sleep apnea, diagnostic testing for those who have signs and symptoms, and then treatment obviously for those who have received a diagnosis. But one of the problems is that we think that only about 15 to 20% of people with spinal cord injury are actually getting that diagnosis of obstructive sleep apnea. And so some of the research I'm going to talk to you about now is I asked the question why. What are the barriers to diagnosis and treatment that are preventing so many from being diagnosed with this condition? So one of the questions that I asked in my research was, what's it like to use CPAP for obstructive sleep apnea when you've got a spinal cord injury? And this study involved 16 people with a tetraplegic spinal cord injury. We started them on CPAP after they'd received their diagnosis of obstructive sleep apnea. And I then interviewed those people about their experience of starting CPAP after 1 month. And I followed their use for 12 months as well. And what they told me was that the burdens of using this equipment were quite substantial. So they talked about the discomfort from the mask, the frustration with using the mask. Some of them felt very claustrophobic. There was a guilt about that extra burden on their partners. They felt like it was just another piece of equipment to manage. Some of them talked about feeling unattractive by wearing the mask. They had a fear of problems or failure, and it upset their established routines. But on the flip side of that, they reported less daytime sleepiness. The benefits were really profound for those who could use it. So people talked about them feeling much less sleepy during the day. They felt more alert, had more energy. They woke up a lot less from spasms and cramping in the night. Their partners reported they were snoring less. They had improved mood, increased productivity, and more social activity. And so what we concluded from this research was that, this sort of decision that people had to weigh up around the burden versus the benefit of the equipment was something that they all actively had to do. So, was it worth their while to use this piece of equipment? Many of them had lots of trial and error and troubleshooting initially, but most of them were able to work through that over a period of time. They told us that they were more motivated by the immediate daytime benefits of using the CPAP rather than sort of being concerned about the long-term health consequences of sleep apnea. They also told us that coming in for an overnight sleep study in a hospital or a sleep laboratory for that diagnosis was really too challenging, and they would much prefer to be diagnosed in their own homes. They said that, sleep apnea was kind of a low priority compared to a lot of the other spinal cord injury complications that they were experiencing. And the other really interesting thing that we found was that many of them talked about the fact that they thought that they just that their sleepiness was just a normal part of their spinal cord injury until they actually got treated for their sleep apnea, and they realised, just how much better they felt. And that's illustrated here nicely by a quote from one of the participants who said, "I didn't realise. I just took it for granted that this is what happens when you get old with quadriplegia. I just thought, well, suck it up. But yeah, I realised what I'd been missing out on because now I feel so refreshed. I've got more energy, more get up and go, and there's a lot of things that I didn't accomplish during the day that I can do now." The other study that I want to talk to you about, and I apologise for this blocking my slides, is I asked the question, how are spinal rehab units managing obstructive sleep apnea, and why do they do it in the way that they do? And so this study involved interviewing 20 doctors from 20 different spinal units around the world. And very, very briefly, what I found was that the majority of them were looking out for the signs and symptoms of obstructive sleep apnea, and whenever they suspected it, they would refer to sleep or respiratory specialists or GPs for that ongoing sort of management of the diagnosis and the treatment. They didn't do it themselves. However, there were 3 out of the 20 doctors that I interviewed who reported that they had trained themselves up and their team up to be able to diagnose and treat sleep apnea from within the spinal rehab service. And so that threw up my next question, which was, well, could this be one solution that, one way that we could improve the rates of diagnosis and treatment? The people with spinal cord injury had already told us they don't want to go to a sleep laboratory for a diagnosis. Could we start doing this on the ward in the spinal rehab unit to boost those numbers of people being diagnosed? And so I was really lucky. I got a grant through the Queensland University of Technology that enabled me to travel to those 3 centres. They were in Switzerland, the Netherlands and in Canada. And I went there for a week at each place to really understand how they were managing obstructive sleep apnea in their rehab units and to determine what the common elements were. And what I found was that that each of them had a small, highly skilled team. They'd skilled themselves up in how to manage sleep apnea. It was led by the doctor and supported by the nurses or allied health clinicians who were experienced in respiratory management. They had a very collaborative model of clinical decision-making involving the whole team and the patient. And they had these routine processes and pathways, as you can sort of see by my diagrams that I drew, to help them sort of manage this. They used very simple diagnostic and treatment techniques on the ward, and they only referred to the sleep or respiratory specialists when there were really complicated cases. So they did most of it on their own. Which threw up the next question, which could we actually replicate this kind of model of care in other spinal rehab units? And so that brings me to the current project that we're working on, which is to try and establish a new model for screening, diagnosing and treating sleep apnea based on what I'd found in the overseas sites for people with spinal cord injury undergoing their rehab at Royal Rehab Hospital in Sydney. So Royal Rehab had put up their hands and said, we want to be able to provide this service. We've partnered with them and we're establishing this model of care and evaluating it to see if it's feasible and it's acceptable to the patients of the unit, the staff and the health service. And we're also going to be interviewing people with spinal cord injury to understand the experience of what it's like to be diagnosed with and treated for sleep apnea whilst they're undergoing their rehab. We are heavily into this project now. We've divided it into 4 stages. The first was just to kind of set it up. We've chose the team from within the Royal Rehab unit of the doctors, the nurses and the physios who are going to be actually providing this service. And we also established a clinical advisory group and an evaluation committee. And I'm very pleased to say that we've got 2 people with spinal cord injury who sit on those committees and sort of contribute their insights and really sort of keep us on track and make sure that we're thinking about things from their perspective. Both of them have obstructive sleep apnea and use CPAP. We also then developed and adapted that model of care. So it's all based on what I'd found overseas, but we adapted it to suit the service at Royal Rehab in Sydney. And in March this year, we travelled up to Sydney to provide education and equipment to enable the service to enable the Royal Rehab team to provide this service. And that photo there was one of our education sessions. And now they've started. So we've got a 12-month pilot project where they are now screening, diagnosing and treating sleep apnea on the ward. And we're following that very carefully over 12 months to evaluate it at the end. Because we may end up, if this works, then this could be a way that we could introduce a similar service in other spinal cord injury rehab centres. That concludes my presentation now. I did want to also just show you all another way that we've partnered with people with spinal cord injury in this research. So we got some funding from the TAC to create a series of peer-led videos of for people with spinal cord injury who we had diagnosed and started on CPAP, talking about their experience. And the aim of this project was to create these short videos that could be sent out on social media to raise awareness amongst the community about obstructive sleep apnea and how you might go about getting treated. Now, I know I don't have a lot of time here, but I will just play a little snapshot of the video, and you can obviously go to the Institute for Breathing and Sleep website blog to see these.
I would tell someone who's suffering from fatigue to definitely go and talk to their GP. I just didn't realise that being in a wheelchair was a risk factor for sleep apnea.
I did have a particular problem with fatigue. I was so fatigued that I would fall asleep, even driving my wheelchair.
The fatigue with Ben was atrocious. He would fall asleep during the day.
It's just so hard to function without sleep. It's just fundamental.
During the day, I'd find myself nodding off doing the crossword or even just reading the paper on.
Fatigue became an issue for me when I had my daughter 6 years ago. I thought it was just a normal part of being a parent. I just got stuck into those bad sleep patterns.
I didn't think much about it until I was at a dinner at the RSL with a few cobbers, 3 of them.
All right, I'll just pause that there because I know I'm running out of time. But thank you so much for listening to the presentation, and yeah, I'll see you all later. Bye.
Thank you, Marnie, for your great presentation. Some really interesting points there. The thing that really stands out to me as a person with spinal cord injury is the high prevalence of this issue. And I know in previous chats that it really was something that stood out to me. And it's not something that is always spoken about within the spinal community. I know in chats that I have, but just thinking as well, issues that are spoken about a lot within the spinal community are obviously pain and mental health. Is there potentially a link between some of your work and addressing those issues within the spinal cord community?
Absolutely. Thanks, Antonio. It's a really good question. And, you know, that sort of actually brings me to another study that we've just done recently where it was through the Australian INSCI survey where we had over 1,500 people living with spinal cord injury answer that survey. And one of the things we found was that sleep, pain, and mental health were all really closely related to one another. And we think that it's really that sort of bi-directional relationship. So people who have poor sleep, it will impact their mental health and make their pain worse. But it also happens in reverse. So if you have mental health problems, you're not sleeping as well, or if you have pain, then often it affects your sleep. So, you know, I think one of the things that we need to do is to try and work out, I guess, a bit more of a holistic model for how we can treat pain, mental health, and sleep. Because I think if we treat all three together, we're probably more likely to get a better outcome for people with spinal cord injury.
I mean, with that holistic, I guess, model in mind, what we believe big in at the SR is obviously improving the overall quality of life of people with spinal cord injury so they can engage in the community a lot better and achieve their goals. So with that in mind, in the participants that you've had, that you've been able to work with and address these issues, have you seen much flow-on effect, not just in their sleep, but in their overall quality of life?
Absolutely. Yep. So, you know, in that qualitative study I did where I interviewed people about who had been treated for sleep apnea with CPAP, you know, they really did talk about this profound effect it had on their lives. You know, people had more energy, they were more alert during the day, they could do more during the day, so they participated more, and they just felt a hell of a lot better. And they couldn't believe, you know, I think one of the really big things that we learnt was that often people don't realize either how sleepy or rotten they feel until they've been treated, or they put it down to something else. They put it down to their medications or their pain or just the fact that they've got their spinal cord injury or, you know, or other things that are happening in their lives. And then they sort of get this chance to try treatment for sleep apnea and they realize that it was that all along. So, you know, that's why I guess one of the reasons why we are trying to promote, you know, getting screened and diagnosed and treated if you have it, because it could just make your days a lot easier. And the other thing I'll say there is that in that same survey that I just spoke about, we're also able to link sleep to employment outcomes, participation outcomes, and quality of life. So, you know, it really does have a big impact on people's lives. And it's a bit of an insidious thing. You know, often there's so much else going on in the lives of people with spinal cord injury that it sort of gets put back here. But, you know, it is something that can be treated. And if it, you know, is treated, then it really can help improve that quality of life.
Awesome. Well, thank you so much for your presentation. I look forward to seeing where your studies goes, and I'm sure lots of people in the community are really excited about the outcomes.
Great. Thanks, Antonio.
I hope you enjoyed that chat. I know I definitely enjoyed chatting with Marnie about a really important issue amongst people with spinal cord injuries, and as discussed, you know, an issue like addressing sleep can really have an important flow-on effect with overall quality of life.